Hello, my name is Ricky and I'm a psychologist here at We.Care. This video is a part of the CSPPA mental health program, and today we are going to talk about how to get started with text-based therapy. The way it works is that it's not live, but it's asynchronous. This means that when you text your psychologist, he or she will reply and get back to you the next time that he or she is online. So you get a reply fast and within 24 hours. And in that way, you will have time to be able to absorb and express what it is that you struggle with that day or in that period of time. And also, when you get the reply, you also have some time to reflect on what it is your psychologist mentions and advise you to do. Be aware that it takes quite a bit of energy to be in text-based therapy because you only have the written words to describe yourself and to describe what it is that you are going through. Before we move on, I would really like to give you some tips and some advice on how to get off from a good start with your text-based therapy. Number one, introduce yourself. It sounds very simple and very obvious, but what I mean is that you introduce yourself, you describe your situation, and as I mentioned before, you give some information about what have you done before to solve the problems or handle the challenges that you face at the moment. It can be that you've been in therapy before, or maybe a friend has given you some great advice. But either way, describe your situation. Are you married? Are you single? Do you have kids? Are you working at the moment, or are you out of job, studying, so on? So you kind of paint a picture of who you are, because in that way, your therapist will be able to move in and help you in the best way possible, because she or he has a understanding of who it is that they're texting with. Number two, schedule it in your calendar. I know this might sound like the opposite of having a very, very flexible way of getting therapy, but the feedback that we've heard from many of our clients is that scheduling in some time to express yourself and write it down and write these texts to messages to one's psychologist is very helpful, because it's a part of the process, getting it out. And also, when you can see that your psychologists have replied, set aside some time in a quiet place where you can read it and digest it. Because one thing is to exchange these messages, but another thing is to actually integrate the advice in your life and test out the things and maybe exercises that your psychologists give you. Remember that it can take quite a bit of energy to be in therapy. So if you feel more tired or exhausted or feel to take a nap, which you usually don't, it's very normal and it's a part of the process. Another thing is that if you find out during your process that this text-based therapy is not really a good match for you, you can always change and switch and add on video consultations, so you both text and have video consultations, or only have video consultations. A common question is, for how long will I need therapy? Or how many sessions will I need till I feel better? And that is difficult to say in advance. It depends on the struggles that you have, if you have a diagnosis or a condition that you seek treatment for, or what your life looks like. So this is something that you'll discuss and talk about with your psychologist, and together you'll figure out how your mental health journey will look like for you. Here in We.Care, we are of the belief that nobody should be alone with mental challenges and struggles. So we would like to encourage you to speak up and tell somebody if you're going through some difficult stuff at the moment. so they can be there for you as well. If you want to read more and get more resources, you can always go to We.Care and read much more about mental health and conditions and what you can do yourself. Thank you for watching.